this, but yeah.
Okay, is everyone ready to go? All right. Good afternoon. My name is Rebecca Ladd, and I am part of the Natrona County Emergency Operations Command Joint Information Center. Before we get started today, I'd like to take a step back and explain what this group is and why we're doing this. In times of emergency across the nation and in our community, local agencies come together to better serve the community. In Natrona County, we've activated the Natrona County Emergency Operations Command, which is composed of all local law enforcement and first responder agencies, large organizations such as Wyoming Medical Center, the Health Department, and School District, as well as representation from volunteer groups and elected officials. We come together for one purpose: to ensure that all available resources are being utilized to serve our community during times of emergency in the most efficient and effective way possible to have the greatest impact. This group shares information, identifies needs, and addresses those needs together. As part of the Emergency Operations Command, a subgroup of public information officers from the individual agencies come together to communicate timely and accurate information to the public on behalf of the entire operation. That group is called the Joint Information Center, and that is the group that has been holding these daily news briefs. The purpose of these news briefs is to gather timely and accurate information and communicate that to our public through a single portal. Here, you will hear information from local leaders of organizations to include the Health Department, City of Casper, Natrona County School District, Wyoming Medical Center, Casper College, and many others. We've established live feeds of this news brief online on the City of Casper's YouTube page, as well as the Casper Natrona County Health Department Facebook page. For those of you joining us online, thank you for hanging in there with us the last few days as we have navigated through the stand-up of this group. From here on out, if you have questions, comments, or concerns you would like us to address, please comment on the video and we will do our best to address those for you. For today's news conference, we are going to begin with updates from a couple organizations before hearing from Dr. Ganem from the Casper-Natrona County Health Department on the latest COVID-19 information in Natrona County. Lastly, thank you for being here today to our media partners who are working around the clock to bring our community information they need. And to those of you at home taking care of kids, keeping yourself and others safe. We see you, we appreciate you all. And on behalf of the Natrona County Emergency Operations Command, thank you. Also, I would like to introduce Gail Shenfish. She is a nationally certified sign language interpreter and will be joining us for these news briefs to ensure that every member of our community is able to receive this important information. Thank you, Gail, for being here and for your assistance. Moving on to some operational updates. On behalf of Casper-Fire EMS, the best precautionary measures continue to be good hygiene, such as hand washing, and the most recent recommendations of social distancing. Casper-Fire EMS has updated their response to any fire or EMS call involving those potentially infected by the virus. All City of Casper fire stations are open and will continue to respond to all emergency calls for service in a normal manner. Dispatchers are pre-screening all 911 calls received at the dispatch center. A list of questions are being asked to identify any potential COVID-19 cases. This information is relayed to responding units and supervisors are then given the discretion to deploy or minimally deploy personnel to make patient contact, depending on the severity of the situation. This modified response is to protect our firefighters from potential exposure and to help maintain our limited personal protective equipment supplies. On behalf of the City of Casper, Casper City Hall will be closing to the public effective Thursday, March 19th. According to City Manager Carter Napier, City Hall operations and our service to the public will continue. During this period, we have established alternate processes for customers who would normally visit City Hall. Napier reminded that many city business items can be handled through the city website or over the phone. The City of Casper website is casperwi.gov. The general city phone number is 307-235-8400. To pay a utility bill such as water, sewer, and trash, collection citizens can pay by check, which can be mailed in as normal by using the envelope enclosed with the customer's monthly bill. Payment by check can also be taken at City Hall drop box, which is a secured metal box at the southern end of the building. Customers should place their check and their payment stub in an envelope before placing it in the box. The box has a blue lid and it is labeled City of Casper Utility. Customers are asked not to place cash in the drop box. Payment by credit card online can be done by visiting the city's website and then hitting the blue Utilities button on the lower right-hand side of the screen. From there, that link leads to the secure payment site, and that should be followed. Credit card payments can also be taken over the phone by calling 1-844-235-5262. Customers will need to have their utility account number located at the top of the utility bill, as well as their credit card number. Customers can make an electronic payment from their checking account by using their bank's personal banking website. Customers can sign up to make ongoing payments from their checking account by signing up for the city's Easy Pay service. Easy Pay causes the bill to be paid automatically every month directly from the customer's checking account. To sign up for Easy Pay, customers should visit the city website and hit the blue Utilities button on the lower right-hand side of the screen. From there, customers can download and print the Easy Pay form and mail it in with a voided check. To make a different kind of payment other than a regular utility bill, payments by check can still be mailed in as normal. Payments by check can also be taken to City Hall drop box, which is secured at the metal box at the south end of the building. Payments by credit card can also be taken over the phone. Customers who are submitting forms and similar paperwork can do so. Many forms and documents can be submitted electronically. Before making this sort of submission, customers should contact the relevant city department directly by phone or email, or call the general city phone number. Those documents can also be dropped off in the City of Casper Dropbox, accepted through regular mail, and for certain transactions, city staff members can arrange to meet the customer just outside of City Hall. Customers who think that this sort of service will be necessary should contact the relevant city department directly. For engineering and public utilities such as water and sewer, the following can be handled over the phone or via email, including payment via credit card. The phone number to call is 235-8341. Those include street cut permits, traffic control permits, curb cut permits, permits to construct, physical tap fees, system investment charges, outside agreement application fees, and plan reviews. For planning and building, the following can be handled over the phone or via email. The phone number is 235-8254. Building inspections will remain the same. Call to schedule an inspection time. Contractor licensing exams will cease until at least April 6th. Contractors may still call to set up a testing date for the exam. Building permits, fence permits, and sign permits can still be requested. Applications and plan submittals are encouraged via email. Mechanical, electronical, and plumbing permits will only be taken by phone, fax, or online. At this time, I invite up our Natrona County Commissioner.
Good afternoon. My name is Eric Nelson, and I'm actually the Natrona County Attorney, and I'm appearing on behalf of Natrona County and the Natrona County Commissioners. I would like to inform the public that at the current time, it is business as usual at the county courthouse and the Townsend Justice Center. All offices are currently open and serving the public. We are working closely with the Casper-Natrona County Health Department, and as the situation is fluid, this status is subject to change rapidly. Once again, currently all county services, with one exception which I will address, are being provided, and the courthouse and the Townsend Justice Center are currently open. That being said, Natrona County is encouraging all citizens to take advantage of the services available through our website or mail. The following services are available without the need to physically visit the courthouse: pay property taxes, renew license plates with a postcard received via the mail, apply and manage building permits, search county records. The basic search is free. Daily, monthly, and annual subscriptions are available. Daily Nordic Trail passes can be purchased online, as well as burn permits can be applied for online. In addition, citizens can sign up for AlertSense, which provides emergency notifications which can be filtered pursuant to the individual's desires. The county provides GIS services, and individuals can access property tax and assessment values online. The Natrona County website address is natrona.net, and all online services as well as telephone contact information can be accessed here. Currently, a link to a coronavirus dashboard is being developed and will be posted shortly on the Natrona County website. This dashboard will include up-to-date information regarding the virus and the community response. Also, the Natrona County District Court has indicated that all jury trials will be postponed until May 15th or later. The district court judges will be contacting the press with more information with changes to in-person court appearances. As I mentioned, there is one county service that has been closed, and that is the Natrona County Parks has made the decision to close the Nordic Lodge on Casper Mountain. Due to the inability of the vendor to procure supplies and the closures in the community, they have made the decision to close the lodge through the remainder of the season. However, the trails remain open, and we would encourage everyone to get outside to the extent possible. But again, the lodge has been closed. We are asking that all individuals who require in-person assistance to take the recommended precautions, such as please observe 6 feet of social distancing when visiting the courthouse or the Townsend Justice Center. Cover your mouth and nose when sneezing or coughing. Please wash your hands upon entering and after leaving the courthouse. If you are sick or exhibiting symptoms, please stay at home. On behalf of Natrona County, we would like to thank all individuals who are working tirelessly to get our community and state through this crisis, and to the public for its understanding and patience. Thank you.
Good afternoon. My name is Tanya Sutherland, PIO for the Natrona County School District. Effective today, Wednesday, March 18th, all NCSD employees are back on duty. This will be a work from home model for the majority of employees. School and NCSD buildings will remain closed through April 5th, 2020. We are confident in the exceptional ability of all employees to continue to maintain effective services for students and school families while keeping a commitment to their individual health and safety. We are dedicated to continuing to provide as much academic support as possible to students and families during this time. Teachers and staff will continue sharing information and resources via school social media platforms, emails to parents and guardians, and other communication platforms to assist in keeping your children active and engaged in educational opportunities while keeping their health and safety as the highest priority. These educational opportunities are not required for grading purposes during the March 16th through April 5th closure. These activities are opportunities for review, practice, and continued academic engagement. It is highly encouraged for the continued academic success of students that we remain engaged in the education process and continue learning as much as possible. NCSD will also be sharing educational resources and information via our NCSD Facebook page. We greatly appreciate all parents and guardians for your continued dedication to keeping your child engaged in academic opportunities during this time. Your partnership during this time is critical for continued student success. We truly are better together. NCSD Food Service will provide a takeaway meal Monday through Friday from 11:30 a.m. to 1 p.m. to all individuals 18 years and under at the following sites: Bertie James Elementary, Paradise Valley Elementary, Midwest School, Lincoln Elementary, and the Casper Recreation Center. Additional locations have been established and will start on Friday, and we will begin sharing those sites shortly. Signage will be outside to direct individuals on where to pick up the meal. As the situation around COVID-19 is rapidly evolving, proactive and precautionary planning is underway by NCSD in order to identify a variety of options for continued learning and success through the remainder of the school year. We will continue to provide updated information as it is available for students, parents, guardians, staff, and our community. We are asking families to please follow the guidelines as identified by the Casper, Natrona County Health Department, Centers for Disease and Control, and other health experts in regards to social distancing and other health and safety guidelines. The safety of our students, staff, and school families remains our top priority. We appreciate the patience and support of our entire community as we all work together to keep our schools, families, and communities safe.
Good afternoon. I'm Christy Blyzecker with Wyoming Medical Center. The respiratory symptoms screening clinic is open and seeing patients. It saw 131 patients on March 16th and 155 on March 17th. Over those 2 days, 14 patients were tested for COVID-19 at the clinic after meeting Wyoming Health Department criteria. So far in this period, Wyoming Medical Center has tested 4 people for a total of 18 from the clinic and the hospital. It's important to remember that the respiratory symptom screening clinic does not automatically provide COVID testing upon request. We have not been immune to the national shortage of COVID-19 tests and are following Wyoming Department of Health and national guidelines to determine who needs the test most. In Wyoming, we have limited test kits available, and we might not see that patients meet the criteria to be tested. We want to ensure that our most vulnerable people, especially older adults who are at greatest risk for serious complications and death, are tested first. Even if we do not test for COVID-19, even if we do test for COVID-19, we will not receive the test for several days. The clinic is located at 245 South Fenway Street. It's open from 8 a.m. to 8 p.m. every day. And the purpose is to help screen, evaluate, and treat respiratory symptoms while limiting local transmission of infectious illnesses, including influenza, RSV, COVID-19, and other illnesses. The clinic evaluates and treats cold, flu, and other respiratory symptoms, including fever, sore throats, cough, nasal congestion, chest congestion. Wyoming Medical Center is also very appreciative of the community's patience, understanding, and cooperation with our response to limit community transmission and protect our patients and staff. We are allowing one visitor per patient per day in the hospital for most patients, and all visitors are being questioned regarding their respiratory symptoms. We know this is a challenging situation for everyone, and you can find all the hospital's latest updates at wyomingmedicalcenter.org/COVID.
Good afternoon. I'm Haley Bloom, and I'm the Public Information Officer for the Casper-Natrona County Health Department. Thank you for joining us today and for your assistance in providing up-to-date factual information to our community surrounding coronavirus, otherwise known as COVID-19. As of right now, we currently still have no confirmed cases in Natrona County. However, we do have 15 statewide confirmed cases. These cases are located in Sheridan, Laramie, Park, and Fremont counties. The Casper-Natrona County Health Department hotline is still a resource for those who have questions, need information, or are experiencing symptoms and do not have a healthcare provider. This line is currently operating Monday through Friday from 8 a.m. to 5 p.m. Please note that this is a Natrona County hotline, and we are unable to provide many resources or specifics for those outside of Natrona County. If you're experiencing symptoms, please call your primary care provider first. If you do not have a primary care provider, you can call our hotline at 577-9892. Again, we do not want citizens self-reporting to the emergency room. This places unnecessary burden and risk onto our medical services. If you're experiencing significant shortness of breath, please call 911. Due to an increase in call volume on the hotline, if you need help with information, events, or things unrelated to symptoms, you may contact us at covid@cnchd.org. I'll now turn the podium over to Dr. Ghanem, one of our Natrona County Health Officers.
Good afternoon. I think at this point everybody has heard enough about COVID-19, how we can try to slow it down, what to do, what not to do. We have seen countries around the world who were very aggressive in trying to control the epidemic, and who were successful. We have seen other places in the world where they did not get on top of the situation, and it kind of got out of hand. At this point, we do not know of any confirmed case of COVID-19 in our community. And this has been stressed multiple times. The problem that we face is a problem of shortage of testing kits. If we had enough testing kits, we would probably be, at this point, testing almost everyone who has any respiratory symptom. But since there is national shortage and very few of these kits that have been allocated to our community, we have to be very stringent in selecting the patients that will be tested. There's a lot of other viruses that are going in the community. Not everyone who gets a sore throat or a runny nose or a fever has COVID-19. However, anybody who has these symptoms may, if he had been or she had been exposed, have COVID-19. At this point, what we are stressing is that anybody who has any respiratory symptoms, if you have a cold, stay home. help all of us. If you have a common cold and it's a nothing, you have helped us by not spreading it around. And in the event that is so far unlikely, and I have to stress this because we do not have, as of now, a widespread of the epidemic in our area. In the event that it's unlikely that you have COVID-19, also you have helped us in the community. Our community really, I think I'm very impressed with the response that you're having, how everybody's coming together, and how everybody's doing the best they can so that everyone is safe. The people who are the most vulnerable are our elderly, our people who are immunocompromised and don't have a good immune system, our homeless population. It's very easy in these times for each one of us to think about himself and his family and the people around him. But I think we also have responsibility to our older population. As part of our response, we have one person who, from our group, and I want to recognize him really, his name is Dr. Marty Alboga, who really has stepped up, and he's going to help us tremendously, working with nursing home and with the shelter, to try to also, as much as possible, protect those people. I think nursing homes have done and started visitors policies and all this to try to decrease as much as possible the risk of transmission inside of the facility. And I really want to take this as an opportunity to ask every single person in the community to respect all these measures that are being taken. This is not a drill. This is real. All what we have to do is look outside our community, to the world, and see how this has affected and ravaged communities. It's absolutely not a panic situation, but it's not a situation where that we're gonna take lightly. I think individual responsibility, and as my partner, Martel, who we've seen many times, had said, common sense goes a long way. The Wyoming Medical Center has put together a very robust team that is working in the hospital to try to streamline how the situation goes in, and if someone potentially has an exposure to COVID-19, what we're going to do with them, and how things are going to be processed. And also our medical center, which I think is really has stepped up and set up a clinic, the respiratory clinic, and the goal of the respiratory clinic is to decrease the congestion at our emergency room and provide a much needed service. We worked with the administration, with Dr. Eddie Young, who's the chief of staff, and we're still working on streamlining the process so that we also decrease as much as possible the exposures in that clinic itself. And I cannot stress this enough. Anytime you can use a phone, use the phone. Don't go there. Use the phone. Check on your neighbors. See if they need something. You don't have to go and give them hugs. But let's all just be good citizens in here. Right now, we're also working with DOC and we're working with the elected officials in the county, the city. And since we do not have any documented case in Natrona County, we are recommending social distancing. You've heard it many, many times. But right now, we're not recommending any closures of businesses. We do want to stay ahead of the epidemic. We do encourage businesses to have contingency plans. We're working with industry leaders, so the commissioners, and the city and the mayor, and all those guys to try to decrease as much as possible even the economic blow. My job is not to policies. My job is just to give some ideas, directions, and make sure that the public is safe. I don't know what else to say. I think I'm gonna open it to questions.
How significant, I mean, where is the hospital in the county at in terms of supplies?
Personal protective equipment is crucial in these situations. And we have dwindling, I think, supplies. The problem is that when someone has COVID-19 or once there is an epidemic, and said it before, but I'm gonna go through this again. The doubling time of an epidemic, if it goes unchecked, like they need to stress this point, if it goes unchecked, the doubling time is almost 6 days or 1 week. So if you start with 10 people who are sick now, you're not gonna feel it now, you're gonna feel it in a month or 6 or 7 weeks. You can do the math and go like 10, 20, 40, 80, and so on. So what we want is to preserve our PPEs as much as possible for the time when this is gonna hit. We hope it doesn't hit. We took measures at WMC to try to preserve as much as possible whatever limited resources we have. We've asked our elected officials to also help us request from the state, from the national stockpile, have some personal protective equipment for us. The last thing we want is like nursing and physicians and essential staff, EMS, and essential responders being dispatched to take care of patients with COVID-19 without the proper protection. I cannot give you an accurate answer as how much do we still have. I think the problem is also how long can you last. If you're using like 5 isolation rooms today and you start using 20 isolation rooms tomorrow, you quadruple what your really needs are. So I'm gonna tell you that we are in need, but I can't give you exact numbers.
Have elective surgeries been eliminated or postponed?
Yeah, most elective surgeries are currently being put on hold.
And that's because of the supplies, right?
Supplies are the main thing. So the hospital, I mean, we have plenty of beds in the hospital right now that are empty. But if we go to our PPEs and what have you, this is one of the main concerns that we have. You're absolutely right. We're not doing a lot because we don't have the supplies to last long. So it's more a strategic plan.
How can the hospital get more supplies? And is that?
It's a national shortage, so they're working with their suppliers. But also, I think we're trying to discuss this with the state and see if we can have from the national stockpile.
Is there any like a ramp of supplies like on the near horizon, or is it still in the process?
I don't know.
Where are you guys at as far as getting test kits go?
The main problem with testing really is the medium that we have to put those swabs in to send it down to the central lab. So this should be like it's a vital medium. If you don't have the medium to put the swab in, the test is not going to be valid, it's going to be rejected. Wyoming Medical Center has 400 of these. I'm just going to give you those numbers because I think that's what you want, which is pretty good, but we cannot test everyone who comes in and say, I want to be tested. The state is allocating to us as we go how many they're going to send to us. I'm going to tell you they're not very many. So even if in the best of words, what I would like to do is like to have at least 50 tests around the day, maybe 20, 50 tests around the day, so that I know what's in my backyard. But we don't have that capacity, and we're not the only community that doesn't have that capacity. So this is why we're going through the screening process to decide who will we test and not. And this is really related to epidemiology. I want to take this minute here to discuss what does that mean in epidemiology. I do feel really that ultimately we're gonna get COVID-19. But one of the tools, for instance, that we've used over the last few hours, 24 hours, is like, we contacted the state and we asked for information about the people who got tested and were positive, and we specifically asked that those people been to Natrona County while they were sick and or any time over the last 14 days. And if that was the case, and you come to Fremont County and those patients, just like you were sick in here, then that would have been a much higher level of suspicion of this being our community now. The answer was no. So we were really very relieved that none of those cases that had been already identified in Wyoming had any epidemiological link, means like have been to our town or the county, not only Casper. So we're trying to use all this information to come up with a cohesive plan, and we do not want to start shutting down businesses and restaurants and what have you. And I don't think we're at this level, not yet. But it's all this information that may be changing, and we are going to be in constant communication with the city, commissioners, everyone here in town, so that we can formulate the plan. Any other question? Thank you.
Okay, I promise we're almost done. I do want to have a quick side note for everybody joining us online. I know this is a lot of information that we are sending out, a lot of phone numbers, a lot of emails, a lot of web addresses, all of the prepared statements that we talk about in the JIC, the Joint Information Center, which is probably about 80% of today's presentation, will all be pasted into the text body of wherever you're watching this. So whether you are on Facebook Live or if you are on YouTube, here momentarily, once we're done here, we will be copying all of that there for your reference and easy reference later on. So before we end, I do have just a couple more updates on behalf of the city of Casper, so bear with me. The following is a list of city status of city services as of today, March 18th. The city is doing everything it can to safeguard the health of its employees in order to serve the citizens of Casper. Additional information will continue to be made available. For additional information, citizens can email or call the city. For critical services, such as water, sewer, garbage collection, and landfill operations, all water, sewer, and garbage collection services will continue uninterrupted. The landfill will remain open. All buildings at the solid waste facility are currently closed to the public with the exception of the scale house. The scale house has a hand sanitizer table with a note to customers that customers are required to use the hand sanitizer before approaching the payment counter. For the police department, fingerprinting services are suspended, bin inspections are suspended. Police officers will be using an alternate reporting process for some police issues when appropriate. The community service office is currently closed to the public, and pharmaceutical and over-the-counter medicine drop-off disposal is still operational. For the fire department, public access and tours of fire stations have been suspended, and public education activities have been suspended. For cemetery office services, there is limited public access to the cemetery office. The Casper Event Center is closed and being used for emergency operation meetings. And Fort Casper's museum is closed. Again, all of that information will be online to all of you joining us on the other end of the screen. We thank you all for tuning in today and for joining us here in person. As soon as we have more information in regards to the Natrona County COVID-19 response, you can expect a daily news brief on behalf of the Natrona County Emergency Operations Command. Does anybody else have any other questions for anybody who spoke today? Okay, thank you very much. For our press partners, we have some housekeeping things once we're done.